This segment of CoastLife is sponsored by Beebe Healthcare.
Well, ladies, especially if you live in and around the Long Neck area, you might be familiar with the idea that women's health can be a little tricky, from long wait times to actually making those appointments, because we all know how busy we are. It can be a lot, but that's okay. Our friends at Beebe Healthcare are here to provide quality women's health care to you. And we've brought in doctors Jenna Dafchek and Sofia Perez Delgado. Welcome, ladies.
Thank you.
And you guys are with the practice, the primary care facility that just opened in Long Neck, but today we are talking specifically women's health. So Dr. Dafchek, why don't we start with you and a little bit about your experience as an obstetrician. Did I get that right?
Yeah, so I'm a family medicine doctor who also does obstetrics, so I do a little bit of everything.
Great.
I see newborns, kids, adults for chronic conditions, and I also do a lot with women's health, including regular screenings, pap smears, STD testing, and obstetrical care throughout the pregnancy and delivery.
Yeah, so why would you guys emphasize just how important it is to, be seen for those things, whether it's those prenatal appointments or just your overall general women's health, like a pap smear?
Yeah, so I think when we think of the age for these people, oftentimes women in their 20s, 30s, 40s, overall pretty healthy, don't feel like they need to see a doctor, but preventive care, making sure they're up to date on their cervical cancer screening with pap smears, making sure that they know the choices regarding contraception, pregnancy, caring for pregnancy is so important, and it's great to get them in before an issue comes up so that they have established care, and that if there's any issues, they can talk to us.
Yeah. Now, Dr. Perez Delgado, let's talk about your role a little bit here at the facility and what your role is.
Yeah, so I'm a third-year resident. We have different levels from 1 to 3. You will be coming to the visit. You can schedule a visit for like a preventative screening. It can be to establish care. The patient will come in. They will see the resident by themselves. They will talk to us. They will let us know about their concerns, about what they would like to do with regards to like if they're planning to get pregnant. We start talking about any kind of screenings they might need ahead of time, any vaccinations they might need as well. We can start talking about their weight, like if that is a problem, if they have any period irregularities, things like that. And then we do like a regular physical exam. And this is when we kind of stop and we let the patient know, if we haven't done so already, that we also have to talk to like our supervising physicians, which are our attendants. So that will be a doctor like Dr. Dafchek. For example, we will go talk to them outside of the patient room. We will tell them about the patient, what they're here for, kind of what are the things that we would like to do. They kind of let us know afterwards, like, oh, I agree with your plan. I think you could consider also doing this or that. We come back to the room and then talk to the patient. We introduce the attending, and then we let them know the finalized plan, and then we talk about follow-ups going on.
Yeah. So as a resident, do you find that to be, there's a lot of independence in
Yes,
that?
definitely.
How does that benefit, both you, the resident, but also the patients, the way that this is sort of, the way appointments are structured?
Yeah. Well, I always like to tell people you get 2 doctors for 1.
Yep.
Yeah.
Yeah, because then you get me, who already did her medical training, and I'm about to finish my residency, and then you go get an attending as well who has all this knowledge and experience for many, many years. So that is a benefit to that. You get like the 2 people. But also we have longer appointment times as well, a structure into it. That way the patients are not running late.
Yeah.
So they also get to talk a little bit more in depth with us versus having like a 10-minute appointment they have to be in and out.
That's great. So you sort of get a built-in second opinion almost.
Yes.
You have I think those longer one-on-one appointment times as well, in case you do have a few more questions. Nobody wants to feel like they've been rushed out of the doctor's office and you're like, they didn't even care about me. That's not the case with you guys.
Yes.
So how should people go about booking appointments? Because like we said, it is sort of a primary care facility, but if they want to specifically book appointments for women's health, prenatal appointments, anything that you guys provide in the women's health department, how should they go about making those appointments?
Yeah, so reaching out to, in general, all of our providers are accepting new patients. So
Great.
Beebe Healthcare reaching out to our office in Long Neck, which is the family medicine office. And if you have a specific women's health concern, those are all getting flagged to kind of be filtered through me to make sure that either I'm available to see them or it's a day that I'm working with the residents, so that we make sure you're getting the proper set of eyes that you need, and we can keep it all consolidated.
Perfect. Now, I know we've also sort of been talking that prenatal care when it comes to women's health, but you guys also have postpartum follow-ups as well that take care of not just mom, but the baby too.
Yep. So we call that dyad care, where we're taking care of both mom and baby. It's one of my favorite appointment types. We can book for both mom and baby in one visit. Makes it so much easier, especially you have a new baby. The last thing you want to do is make 2 appointments, get baby bundled up in the winter, bring him out twice. So this way we can take care of, you know, how mom's recovering from the birth, how she's doing, how is baby doing. We can talk about breastfeeding, since that's really a team sport with moms and babies, and just check in on them all at once to make it a little bit easier for the new family.
Well, that is fantastic, and I know a lot of ladies here in Sussex County, especially in that Long Neck area, are going to take advantage of having this primary care facility, and especially when it comes to taking care of our health. Ladies, make yourself a priority, and doctors, thank you so much for being here today.
Of course, thank you.
Of course. We do have some more CoastLife to get to. If you remember, yesterday we did our great debate. Well, we've got some more results to share with you on the way.